I am excited to present some information about our new Masters in Public Health program at Biola University. What is public health? Public health is the science of protecting and improving the health of people and their communities. This includes conducting scientific research, educating the public about health, and promoting ways people can be healthy. What do public health workers do? This includes being disease detectives, infectious disease control, educating the public about healthy behavior, and even implementing policies to improve communities' health. Some examples of the field of public health includes careers in restaurant inspectors, health educators, scientists, researchers, nutritionists, community planners, epidemiologists, public health physicians, public health nurses, occupational health and safety professionals, public policy makers. These are some examples, and this is a very broad field that includes a lot of opportunities in the field of healthcare. So, is there a difference between medicine, public health, and nursing? Medicine and nursing focuses mainly on an individual patient and see how can we help our patient. Public health looks at communities or larger populations and sees how can we address the health needs of this population. When we think about public health, two key terms comes to mind. It's prevention over treatment and populations over individuals. Public health has an aspect of preventative medicine. How can we prevent diseases from happening before it takes place? And how can we help the health of communities rather than looking at one individual patient? Public health includes programs that have a focus on prevention and helping our communities. These include efforts such as immunizations, screenings, tobacco control, HIV/AIDS prevention, education, promotion of healthy lifestyles, and environmental health. Public health is also very closely associated with missions. This is an area where when there are health needs in communities, in different areas, even in different parts of the globe, public health and missions work hand in hand. So, who can study public health? Anyone with a bachelor's degree or an equivalent that has taken a college-level biology course and a math course is eligible to apply for the Masters of Public Health program. Students interested in healthcare, preventative medicine, community health, missions, behavioral psychology, and also intercultural emphasis. Public health will have an aspect in all these fields. So when it comes to the Masters of Public Health program at Biola University, our mission is to provide a rigorous academic and practical experience to students to help equip them to be public health agents of change. And we help students focus on careers in government health agencies, healthcare systems, and non-profit organizations. We have a few hallmarks in our program where we focus on providing a strong foundation in the principles of public health together with an emphasis in the practice of public health by allowing students to have opportunities in community engagement. We also have a biblical perspective where students are taught a Christian worldview to be compassionate agents of change, to be able to use ethical decision making, and also to be champions of health equality. We also want our students to be impactful, to be able to use the knowledge that you learn through the program and be able to address community health problems. So, the Masters of Public Health program at Biola University has two tracks, a global health track and an epidemiology track. The program requires students to complete 42 credit hours, and this comes out to 14 courses, 11 core courses in public health, and 3 track-specific elective courses. This program spans over 2 years, which is also equivalent to 4 semesters. Highlighting some of the global health courses, we have global health ethics, human rights, integration of global health and missions, community health assessment, planning and evaluation, international program design. For epidemiology, we have courses including global communicable disease control, molecular epidemiology, epidemiology of chronic disease, outbreak emergency preparedness, and cancer epidemiology. Students in each of these tracks will be able to select an area of their interest and pursue some of these courses. There are distinct career outcomes for both the global health track and the epidemiology track. We see a few listed here. For global health track, students can have careers as health educators, public health specialists, non-profit coordinators, international program managers, outreach specialists, and AIDS research associates. For the epidemiology track, students can be epidemiology investigators, medical epidemiologists, infectious disease specialists, clinical epidemiologists. And there are certain overlaps with other areas in public health and healthcare which students can further specialize in and be involved. So, if you have any questions about our program here at Biola University, we have a public health faculty team, including myself, Dr. Daniel Walker, Dr. Brent Peterson. If you have any questions, please feel free to email us, and we will be more than happy to speak about the program, and provide any information needed. Thank you for this time.